So
Raise your
Pretty
hand.
good.
It's in his agenda. If you
6.
follow the agenda along.
Okay.
But otherwise, I'll flip them. Yeah,
They just saw, I went on there last
All right.
week.
Charlie?
Okay, it's
10,000
6:30.
apiece.
I want to call the meeting to order, verify compliance with open meetings law notification, and adopt the agenda. If we can all please stand for the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, consent agenda A is personnel recommendations. Would anyone like to remove the item? Okay, then I'll take a motion to approve.
So moved.
And second?
Second?
All in favor?
Aye.
Opposed? Seeing none, motion carries. On to for discussion and future action items. A is moving forward with 2021-22 precautionary measures and mitigation protocols. So in the packet, there's a presentation. It's in a draft form now. We'll be following along with that, but you'll be able to see it online too in the board packet. Again, it's just draft status. We'll talk through today, list some factors from last year's decision for this year's decision too, and then we'll be back again on the 26th to review it further and take potential action for the next school year.
So I'm going to go through and just talk about what was last year. It seems like a long time ago since we made some decisions, and so this is, as Jonathan said in the board packet, so just wanted to remind all of us of all the precautionary measures and mitigation protocols that were put in place last year as we look at some things. So there were different categories. If you remember our reopening plan, we had topics and areas in there, and from each of those there were other documents that had links to it that got very detailed as far as like what we're doing in lunchrooms and recess, building by building, and all of those things.
Actually, can I add one more thing? This presentation was shared with the Medical Advisory Committee. It wasn't created by them. We shared for any feedback. They didn't give us any feedback, and any recommendations in this is coming from the administration, not the Medical Advisory Committee.
Correct. So yeah, we shared it, and none of them had concerns with what the recommendations were. So, yep, thank you. So just a reminder to our commitments when we put together those last year. We wanted to make sure something was practicable. There would be some things that would be very challenging to put together. It was equitable for all of our students. Safety was a very key, and then also that we kept people informed, stakeholders across the board. So the first thing to talk about what we did last year under health and safety protocols, we had, again, based on that, we had protocols in place regarding face coverings, physical distancing, physical barriers, if you remember the conversations around plexiglass at the time and where we put that in some of our buildings. And we had some enhanced disinfecting protocols. At the point we talked about the cost of barrels of disinfectant, and then had a partnership with the Greenfield, the city of Greenfield and the fire department to be able to get that in bulk at a very minimal cost, and so appreciated that partnership. Within our school buildings, we looked at how classroom and computer labs were set up. There are some standalone computer labs. We did put plexiglass between those because those were pretty close quarters. Many other students also had some one-to-one. Communal spaces and hallways were limited, either cohorting when we needed to use those spaces or looked at some traffic patterns. Drinking waters, so if you're in southeastern Wisconsin, I believe it's called bubblers, were all turned off.
Making fun of that?
I'm not. I have now called them
Good.
bubblers myself. I'm just saying that
Oh,
some people don't.
You, Illinois.
Yep, so those were all blocked off as far as that, but could fill the water filling stations were still there. Entrances and exits, we wanted to make sure there wasn't crowding in that. There were some things as far as parent pickup drop-off, specifically at the high school. We had buses drop off in the back of the building and parent drop-off in the front to avoid crowding. So there were some things that happened. Also in our other schools where typically students had to wait outside before they could enter the building, we let them go right directly to classrooms instead of congregating in some of those areas. Locker and cubby uses were changed, especially cubbies are at our elementary schools. Tried to use some of our outdoor facilities in a lot of the activities as much as possible. Sanitation stations, which really refer to having bottles of disinfectant or the Purell dispensers on all of the walls and all of the classrooms and hallways, which did not previously exist. And then visitors and volunteers were really non-existent last year because of protocols that we followed. Some of the operations last year with transportation, how students boarded buses, having face coverings. We had procedures in place for riding in our own vehicles. If kids self-transported, we had them keep track, or they were supposed to keep track who were in their vehicles that day in case we needed to do contact tracing. And as I mentioned before, some of the drop-off and pickup procedures modified a little bit. So school nutrition, some of the entering and exiting the cafeteria were one way. The high school last year was supposed to have a whole new lunch schedule, bell schedule around that. That got modified because we needed to use many other spaces, as did the middle school, to spread out where lunch was being served. We used gyms and a couple other spaces, the multi-purpose space, to spread students out as much as possible. And some of the pieces with how we purchase lunch, locations where people were getting their food from, and some of the other safety procedures as far as the disinfectants that were used between lunch periods that were different than before. We always cleaned. I don't want people to think that we were not cleaning before, but the level that it was and how we were doing that. We also had every other seat in the cafeterias marked off, so we were keeping the number of students at a table reduced from what typically was where they could sit where they do. In health services, we modified some of the health room procedures that were going on. Students who were in isolation, that compared to students who needed to come in for medication and other reasons, who might have a scrape after they were out for recess. And some of the sick day guidelines as far as returning or symptoms that we were seeing that typically we might say monitor it. If they were COVID-like symptoms, we asked them to check with a physician or the school nurse or health room aides, looked further into those conditions and followed up if students were out for any sick reasons. Before and after school here, the athletic activities were modified. We worked with our conference on activities and athletics. We also worked with WIA, as they also had procedures and protocols. Most of you know that some of our sports seasons were done in a different order than we did normally, and a lot of those protocols were different, which again was outside of our realm really in making those decisions. Some of the community groups and rentals were very limited and non-existent in the beginning of the school year. This spring we did start to open some of those up again to some of our groups and rentals. We started out with very few of those, but we know that our scouts and various other groups do use our facilities. And then the before and after school care, those were really their guidelines. We have the YMCA come in, and they had limits as far as how many they would allow in their program that were outside of our limits, but just the number that they had and the protocols they were following in for check-in, check-out, and what they were doing that had to be an awareness for our buildings. Then under the teaching and learning for last year, coming up with devices for students, we had to make sure that there was a one-to-one at least available. We had to make sure we knew each of the status within families, the different types of devices that were available at different levels. Homebound instruction took on a whole different element last year. It was no longer someone who was out for 3 weeks with a broken leg. It was really, what did homebound mean? It sort of took on that parallel to being quarantined or in isolation, but it really has its own definition. So we'll talk about that in a little bit of getting back to the traditional definition of homebound instruction. And the help desk was also made available to parents who might be home with the child. It wasn't just students who came in to see the help desk. It also was made available to parents. In our student services area, our parent meetings were done virtually, so things like IEPs or DEPs for students. And so that option, because we didn't have parents coming in the building, so we held those virtually. Also, traveling of staff, often how our special education staff might go into multiple buildings and multiple classrooms. We really limited their schedules and looked at those differently, so they weren't doing a lot of cross classroom travel, and really modified what that looked like. And then also limited resource sharing. If it was physical things that they were sharing or touching or using, our OT staff some of those types of things, really having to look at disinfecting differently than we have in the past. The big thing which we all are aware of last year is implementing Canvas across the board. So we had a tool, a learning management system across the board, so all parents had access to that if your student was in or out, or we would have had to, as a whole district, gone that way. And so that was something that we put into place last year. Although understand that it was being looked at before that for a variety of reasons, not because if we ever need to shut down, but there are good reasons to have a learning management system in place. And then we used an instructional delivery framework, a way that engaged all students regardless if they were virtual or in person, that really tried to get to the differentiation that we have within teaching and learning. So those were some of the protocols that were in place that maybe you're like, oh, I forgot about all those things that we did, because I think we focus on a couple of the protocols and mitigation things that are on the top of people's minds, but I needed to refresh everybody the impact that it had across the board on the way that we did business collectively. So we did have a learning model dashboard and metrics. We shared that on our website, and so on Tuesdays and Fridays we updated. Here's one from the beginning of the year, and then the end of the year we modified it. We split out the educators from support staff because knowing that, because that was a key indicator whether or not we were looking at having enough staff to be able to keep our building open. You know, if it was a noon hour supervisor versus, you know, a third grade teacher, that had a different impact on our ability to staff. And so we informed our public about where our case data was. On any given day, we pulled it at the end of the day and we reported that out. Anything less than 5, we did not because of identifiable data. And then we put together some metrics which were done in conjunction with a medical advisory committee in ranges of green, yellow, orange, sometimes in red, using metrics that were there from the internal and external guidelines that we looked at and set that. We do know at that time that other districts use hard and fast numbers, and I think that, you know, in hindsight, using ranges was a little bit better decision to do that, because some hard and fast numbers, if we would have used community data, for example, we were in red the majority of last school year, and that based on what some initial numbers were when they were talking about that. I think in the long run, when we look at our dashboard, Kathy, can you go to the next one? When this was the last one of the last ones. We tended to look at the environmental factors with a higher consideration as far as where we were getting, you know, like, are we seeing some situations that might move us to virtual? The community spread, it was important to know that, but it wasn't having as much of a direct impact on possible switching to virtual or what we were doing. So I think, you know, whether it was hospital, ICU, I think that those were some indicators of how things were going as far as the spread, but it was more important to look internally to know. And so at any time in which we did switch to virtual, at our secondary schools, we did that twice. It was really due to the environmental factors. It did not have anything to do with the community factors at that point. It was a matter of not having enough staff to be able to cover. There were no substitutes available, and we did not have any staff to cover at that point. And looking out how long staff members would be quarantined, it was a matter of, like, we need to take a pause in all of this. So those are the data pieces that we used last year as a quick recap of where we were last year and how that looked, and the measures that we put into place. So many of you are aware that we've been talking about for a while that the CDC was supposed to be coming out with guidance for schools, was supposed to be coming out for guidance with schools, as I've been sharing with you. Well, yep, Friday they came out with guidance for schools, and it's been all over the news, so I'm sure that wasn't necessarily new. But I'm going to ask Stephen to sort of talk about a summary of that, because you could have read the direct CDC stuff, but I'm going to ask him just from a medical perspective what actually was in that.
Yeah, so these are the guidelines, a nice summary of them. And again, they're guidelines, they're not laws, they're not regulations, they're not standards. So they took a look at where things were. You know, they want to make it as a priority that schools are open. They, as the CDC should, are stressing that vaccination is our #1 strategy to get ourselves out of this and to prevent the spread. They still recommend having physical distancing in school. They're still saying that masks should be worn by people who are not vaccinated, and that you should have additional layers of protection. Some of the stuff that Lisa already talked about, that we had going on during the year, such as how to avoid the crowding, how to limit sharing of things, how do you cohort people, things along those lines. And then the last thing that's in here is really what I think is the key that we'll be working off tonight is the local community transmission vaccination coverage are the key caveats to consider. So if, what they're saying is like, this is what we're recommending, but like take it with what's going on in your own local community, because we're not New York City, we're not, middle of nowhere, Wyoming, we're somewhere in the middle, and we have to take into account what's going on in our things and how these recommendations would make sense.
So moving forward, the next few slides, they have the word recommended on there, and right now they are the administration's recommendation for a discussion point tonight and some other points to start from. And so it was easier for us as we've talked about things, what we're recommending moving forward for 21-22. So we're recommending that we continue to just track the case data. It could be zeros or it could be not, but doing that once a week we can't just like go from nothing and say that we're not keeping track of it anymore. So just keeping track of the case data that we get when it gets reported to us. Having some metrics, which means that is there some trigger, and we'll talk about that later, threshold data that we would say, you know what, we need to bring together the medical advisory committee now, because all of a sudden we're starting to see some numbers pop up and we need to have some conversations to see what that means. It may mean nothing, it may mean something, but is there a point at which we would engage that group of people again? And or if there's anything that we'd say, like if this happens, like then we need to consider doing something dramatic. So we consider like keeping track of those metrics and deciding if there's a trigger, and we'll talk about that later, that something would happen. And we would support our health departments, as we have in the past, if they need to do contact tracing. We would support them in whatever efforts, but understand our primary role is not to do the contact tracing at that bulk, that they typically do that with any communicable disease. Obviously, COVID-19 was a unique thing last year in which they were not able to keep that up, and because we were very interested in staying open and in person, we assisted with that work, but that's really whatever they're asking us to do in our 3 health departments that are within our school district as they continue to do contact tracing as cases gets reports. The second list of things is the face coverings, and so we're encouraging unvaccinated persons to wear a face covering. However, it's not required, or we're not requiring that. And again, CDC recommends that they wear that, but we're not putting, our recommendation is that it's not required, but we encourage it of those folks who are not vaccinated. Physical distancing, we will continue to cohort or group students unless what I put in there was no academic priorities are compromised. So I want to explain what that means if that wasn't quite clear. So there are times like at recess or lunch that's not an academic setting, and so keeping kids together or cohorting them or grouping them does not compromise anything academically. There might be a time, however, this last year in which maybe in 2 classrooms during math, we would have pulled 3 students from this classroom and 3 students from this classroom to work together in math, because we would group students. We did not do that as much as we would have, or at all. That is an academic priority to be able to do some of the work that we're doing. So we will continue to, when there is nothing that's being sacrificed academically, keep kids cohort or grouped just from an easily tracing things or making sure we're not having unnecessary contact. But we also want to make sure that academically there were some things that we did not group students that really should have been done. And again, we will continue to distance students whenever possible, and just keeping some of those reminders like, hey, we're all standing together. We don't need to be standing together like there's a big room here, like we can spread out type of thing. So we will encourage that, but we want to make sure that if there's any compromises to any academic things that we're not, which is that whole social emotional learning and all of the stuff with that isn't being sacrificed. And we will continue with some enhanced disinfecting protocols. As I shared before, we have the containers for all of the hand sanitizer in all of the classrooms outside of the hallways and wherever they are. We will continue to keep those supplies, and we will encourage kids to use that and wash their hands. And when there are cases, as we always do, but we will not, the additional spray that required it to be sitting for 15 minutes and some of the stuff that we found with hard surfaces, the transmission isn't there. But we will continue to do the extra cleaning on the high-touch surfaces that we had there to that extent. In a quick review here, I basically took the list of things we did last year and we brought it over here and said if we're going to basically return to pre-COVID, if that means the fall of 2019 or whatever that means, February of 2020, we will continue, we will move back to the way we did things. The things in the right column would be some modifications we might make. So for example, entrances and exits, we will make a conscious effort to avoid crowding whenever possible. Having, 200 kids in the doorway of the middle school waiting to come in the morning is probably not best practice for a lot of reasons. As I shared before, those sanitation stations, we will continue to provide disinfectant in those that we didn't have as many dispensers throughout the buildings, and so we're not going to remove them. We still want to encourage good hygiene, if you will, and washing hands especially. In the school operations then, with bus etiquette, I know that our elementaries have moved to seating charts, and not because of COVID, but it does make behavior situations a lot better. But also encouraging them for our middle and high school routes, because if we do have to keep track of where somebody was sitting, it's a lot easier to do, so encouraging that. And in vehicles, if people are not, because if in our vans, whenever we're traveling, again, encourage those who are not masked to wear masks for if you're unvaccinated, because it is a small area in our vans. Again, that's not a common type of transportation, but it is sometimes when we have that going on. I don't know, Charlie was still considering if you're keeping your bus drop off in the back, and so I think the answer was yes. It worked out well from just keeping less crowding all at the front, so that was a thing that came out of that. So the drop-off pickup will actually stay that way. It keeps the traffic on 116th Street a little less congested also, because the buses can come around and not create so much congestion in the front of the building also. Some of the school nutrition procedures, we will go back. There were things where students couldn't be touching things that they typically would grab their own, even if it was a packaged item. So all of those things. There was always hand sanitizer before you entered any of those places. And so some of those things that we go back to, we'll go back to pre. Our health rooms, we had kept an isolation room. We've recommended just identifying one. If all of a sudden we have a situation, all of a sudden this space turns into an isolation room, but not keeping it unused all year, because it is spaces at a premium, especially at Edgerton, for example. Trying to find that isolated space that's not being used is very challenging to do. We will return to whatever our conference in WIA talks about for athletic and non-athletic events. We've not received anything yet this school year from WIA, if anything will be different, or had a conference meeting yet. So I think they were waiting for some CDC guidance, and then if DHS and DPI come up with anything else. Teaching and learning, we do have a one-to-one situation, so should we need to go virtual for whatever reason, we're in a good place to be able to talk about that, where we need to look at that. Not all kids are taking devices home on a nightly basis, but we're in a much better place to be able to talk about what would that look like and who needs what. We'll continue. We do have a day in October on our school calendar that we will be testing out that situation, that all kids have access at home. Homebound instruction, we'll go back to, we're going to be using the traditional sense of that word, so there were lots of situations which somebody qualified for homebound instruction, and going back to what that meant. We are, however, because we no longer have to say, well, here's just your textbook and good luck and we'll see you in a couple weeks, or have somebody meet with you outside of school. We do have some asynchronous and synchronous options now. Those were some learnings over the pandemic, that anybody who's out on homebound instruction, which is typically, could be a broken leg, it could be whatever that is for, we have some options available to them, so the learning can be a little bit more engaging than maybe it was before. We will continue to provide a virtual option for parent meetings. A lot of parents shared that that was more convenient from them if they needed to, rather than drive here if they were at a workplace or a work site, or even sometimes they were out of state. So looking at those options to keep that there, I think that was a learning that we did, where before we didn't do parent meetings virtually. And so we will continue to provide that as an option to be more convenient for parents. And Canvas will be here to stay, and so what that allows for is that there is some parallel instruction going on. So sometimes our teachers before used Google Classroom, it wasn't consistent, it wasn't all the same. Now that we've had Canvas there K-12, we will continue to say that that's going to be our vehicle that all parents can log on to, or students, even if you're out for a day. We're not expecting teachers to, even if you're out for one day, all of a sudden jump on virtually or be allowed to go into a class. That's a lot to expect. But the ability, because we are expecting teachers to have their Canvas course up to date and whatever they're doing in class, the documents and the learning is there, which is different than having a camera going live in your classroom all of the time. So the access to Canvas will be there now, which wasn't. So I think that that's one of the pieces that, that will enhance that also. This was the part we talked about, and it's really a discussion point. I don't know that we have a strong feeling on there. We did not have an absolute, like, if at a certain percentage this happens, we're going to do that. I think with staffing last year, we shared with the board that we didn't say if 20% of the staff is out or 30% or 40%. What we did say is we will continue to be open unless we absolutely cannot be open. And once we had everybody who possibly could be subbing in a classroom and realized there was nobody else to have, and we were tripling up in rooms, like we were at a point where talking to the principals, like, we just can't do this, we've got to pause for 2 weeks. And we did that twice last year. So we didn't say like if 10 teachers are out or 40 teachers are out or whatever, because it looks different based on the situation. So I think a conversation to have is what threshold or trigger would cause any action by the district. A letter home, hey, we have 1 case in our district, right? Or hey, we have 12 cases in this building, or what is it? So what would be a trigger that would cause something to happen that we wouldn't be doing typically? And that's really a discussion point of whatever that means. As Jonathan shared, the board is scheduled to make a decision or take action on this on July 26th. The plans would be that throughout the school year, as part of my report, to do a report of the status of where we are with any of the data or what's ever decided that we're going to report on. So that's the ongoing report. So, as Jonathan said, the medical advisory committee didn't have any concerns with the current recommendations from anybody that I heard back from. Again, they seem to be in alignment with the CDC. There is a lot of alignment with your local data. Right now, our local data is, and we did not have any cases in summer school. We did not have any, active cases that we are aware of at this point in time. So I'll let Stephen share if there's any additional things before we move into an actual discussion.
Sure. So I can kind of give an update. I just learned some things today at what's called a HERC, which is kind of a regional hospital system where all the hospital systems get together and kind of make sure that they're handling crises and everything. So today was the meeting of the Southeast region, which is Racine, Kenosha, Milwaukee counties. So what we have now is, you've all heard about the Delta variant of it. So what that is, there was the first COVID, then when it gets into a population, what happens is a person can get infected by more than one type, and they can recombine and make a new virus or like a mutation of it. When the mutation is significantly different, meaning it's got different properties, either it's more infective, less infective, it causes more disease, whatever, they label it as a new mutation. So we've got 4 of them so far: alpha, beta, delta, gamma, delta, and now lambda's coming out. So right now we're dealing with delta. That's one that started in India. The alpha was 60 times more communicable than the original. The delta is 60 times more communicable than the alpha. So we've gotten like 6 to the 4th power more communicability of this. What happens when a country gets to the 20% of cases are now Delta variant? Within 2 weeks it's 50%, within another 2 weeks it's 90%. So it spreads very quickly once it gets into a community and overtakes the other mutations. So where the US is now, we were at 20% 2 weeks ago, or no, 3 weeks ago. So now we are at somewhere around 60 to 70%. Now that's the country as a whole. With our country, it's at both coasts. When they look at the state of Wisconsin, they're not checking enough. Like 1 week they reported on 8 samples, another week it was like 12. So at one point it looked like it was 10% of our cases, at another time it looked like it was 70. And that's just because they're not getting enough of the sampling to get a true number. But it is present in our state, but not at the numbers that they're seeing on the coasts. So the things that have happened in other countries, with the original virus, it kind of changed depending on where the local one was. The Delta variant tends to be a little more consistent in its exposure to countries. So the UK is, in England, they are at 69% vaccinated compared to our country that is at about 49% vaccine complete. So what they found is right now, in the last 2 weeks, their national rate of COVID went from 5,000 cases a day to now they're up to 30,000. And to give you a proportion, it's like saying our entire West Coast. So England's population is about the same as California, Washington, and Oregon put together. So that's about what it's looking like. So what they're finding as far as vaccinations is, at this point, it's 99.9% effective against death. Of the people who are in ICUs, 99.6% of them are not vaccinated. Of the people who catch it or test positive, it's 96.7% are unvaccinated. So the vaccines work, and this is regardless of whether it's Pfizer, Moderna, AstraZeneca, Johnson & Johnson. They're all fairly equal. They all have action against this COVID variant. So that's where this strong recommendation from the CDC comes from, saying vaccination works, it's how you keep things open. So that's where we are with this. And talking with the group today, my questions were, okay, compared to the original virus to how the Delta virus is this known to be either more virulent or how's it acting? And the answer I got back was, if you took like 40-year-old healthy man, someone who isn't likely to be hospitalized with the virus to start with, that their chance of getting hospitalized with the Delta variant is significantly higher, but it's still low. So looking at us with kids, the risk of hospitalization is low. Like the risk of death, risk of hospitalization is still gonna be low from coronavirus, even with the Delta variant. However, like I said, there's some small studies that have shown that up to 30% of kids do have long-term effects from it, whether it's like the brain fog, having problems with their sympathetic nervous system, blood pressure, stuff like that. That's been shown to be a lingering thing for 3 months. So it's not just a cold, they get over it and they're as good as they were. There are some significant things that can happen afterwards. So my thoughts in looking at the recommendations going forward is, I think that we still need to be doing the contact tracing that we were. I think we still need to be looking at our case management. I think we need to talk about what this kind of means going forward, as Dr. Olson said. So what does it mean if we've got 3 kids in a classroom, 3 kids in a grade, 3 kids in a building? Does that change what we need to do? Where we are locally, I don't think that masking needs to be a mandate at all. I do think that that could change depending on what we see in our local environment, meaning if you've got 5 kids in a class, does that grade need to mask? Does that class need to mask? We can kind of bring that down. It becomes a little different in the high school setting because, again, kids 12 and older are available to get vaccine. Not mandated. We don't know who has the vaccine. Where we'll find out that kind of thing is when we contact trace, because if you're vaccinated, you don't have to isolate if you were exposed to somebody with the virus. That could be really important to the kids who are in any kind of school activity they don't want to miss, whether it's a DECA competition, a sport, anything like that. The vaccination would be the way of them to be able to continue their education, continue being live and in person, even if they're exposed. Now, the thought is that kids 2 and up will be approved under that same emergency use by the FDA for vaccination, probably not until October. So that's what that'll be. The it'll probably convert from emergency use to fully licensed by the FDA or fully approved by the FDA, probably also sometime around October, November this fall. So the difference, a lot of people ask what the difference is. It usually takes vaccines a lot longer to go through the approval process. The difference this time is people were volunteering hand over fist to be involved in this to get a vaccine approved. So where it usually takes you 30, 50,000 people to get this through, they had 50,000 people volunteering day one to do this. So that's how the process that's been the same for every vaccine was able to be so much faster for this one because there's so many people stepping forward to help with that. So it's not that it's more dangerous or anything, but now they've got millions of numbers talking about its safety. So that's kind of your vaccine kind of spiel. So kind of going down the list, we need to kind of figure out what we want to trigger on people, what we think is a safe thing to do, what kind of information you want to see that would change any action. I think starting at ground zero with no masks is a great place for us to start. Today, July, 16th or 12th, that might be different August 12th, I don't know, but let's start with that here and kind of see what would you want to see or what would convince you that our kids are being safe, our school can be safely open and not causing spread of disease. We've talked before about who can be the vector for spreading this. It can be anybody. It was first found to be less spreading with children, mostly because those early things were done with kids in places with lockdowns, so that most 5-year-olds can't go somewhere without their parents. If their parents are locked down, the kids aren't going anywhere. So when you do contact tracing and stuff like that, it's mostly attributed to parents. What they found in countries where everything was kind of plugged in, that they were able to find that 30% of the cases came from kids, when all things were considered equal, that the kids were allowed to still move around in things, that the kids could be a vector. I really think that with the way the vaccinations are in our country, where the older populations are much more vaccinated, like those over 65, are much higher percentage of vaccinated than our parents are, than the younger kids, that you're gonna see that kids will be how it's spreading now, just because they're the available population. We've seen over and over the vaccines kind of created two populations in America, the vaccinated ones and the unvaccinated ones. It spreads in the unvaccinated ones, and that's who occupies our school buildings. So that's why we need to think what we want to see to help either control pandemic and to keep our buildings open. Questions about anything with that?
Actually, one thing, just as a reminder, can you remind the audience and people watching at
Sure.
home your professional background?
Yeah, sorry about that. So I'm pediatric anesthesiologist. I'm also the Associate Chief Medical Officer at Children's Hospital. During the pandemic, I worked in the command center at the hospital. Part of that work of being the Associate Chief Medical Officers, I also work with other Chief Medical Officers in the area. We work on coordinated responses for the pandemic for the city, for the county of Milwaukee, as well as that HERC region I talked about. A lot of what I did working for those few months in the hospital was kind of looking at how we're going to respond, what kinds of things the hospital needs to do, how to look at what's going on in the environment. So even though I'm not an infectious disease specialist, a lot of this public health issues and a lot of what I've been seeing with the virus is very much on my mind and very much exposed to.
Thank you. Kevin Stahoyak is participating online virtually. Kevin, do you want to start off with any thoughts you have?
I don't know if I have any specific thoughts as far as what we should or shouldn't do on any of those things. I appreciate all the work that went into all of this stuff. I think following the guidelines makes sense. I do like what was put forward. I think continuing to implement some of the things that we've learned from the pandemic is going to help just in general with, I think, people being sick on an annual basis. But overall, I think everything looks good moving forward. I don't have any questions at this time, though.
Okay.
So I have a couple questions, but I'll take one at a time. So do we know of any extracurricular or curricular activities that would mandate a vaccination card? Has any talk had come up any? I know you said we haven't heard anything from WIAA.
No, I think to Stephen's point, the only thing that would happen as far as athletics, that would mandate that, but that would be in classes or anything, if someone is exposed and they are not vaccinated, they would be required to quarantine. So whether it's, if you're out for the play or musical or football, unless you are vaccinated, then you would not be. So right now, doesn't mean that there couldn't be, and I can't think of anything off the top of my head that would be unique to an activity that would require that. Yeah. The only thing I could say is some of our students who have internships or co-op jobs, their employers might require it differently depending upon what their work is. So that's something that we have to be aware of, but that would be because of their work, not because of school here. But that is part of their internship or co-op job.
So I would hope that we would explain that out really thoroughly, that if you do get contact this disease or whatever it may be, that if you don't have that, you may have to sit out. So people know ahead of time. Not saying you have to get it, but this is what may happen.
I mean, if you do test positive, you get a 90-day get out of jail free card
For what?
After.
because you have natural immunity, but it really drops off at the 90-day point. So that's what most hospital settings and everything are using. So if you've had it within the 90 days, you're not rechecked, you're not, rescreened for it. So, as a follow-up, so didn't mean to interrupt.
Jesse?
Don't really have too many opinions. I mean, the information sounded good, and I appreciate all the time and effort that went into that. I think the main concern that we've been seeing is around the masks and the mask requirements, and trying to navigate that line between the two sides of the people who were virtual the whole time because of that reason, and there's still not that vaccine for the children, and the people who have had enough and said, I'm vaccinated, or, everybody else is vaccinated around here, why can't we just have it without masks? So I think that's going to be the only part that's going to be difficult to navigate in terms of that, because the data makes sense, but at the same time, you're going to still have, not taking aside, you're going to have that group of people that chose that virtual for a reason, and just thinking of everyone, how that ends up working out for them, because from what I can see on here, the idea is there will be no, just to reconfirm, the suggested plan is that there will be no virtual for the upcoming school year.
That's correct.
Okay.
I did want to also, when we were talking, one of the things that I think we do need to make a point with and really stress with our teachers, and that is making sure that we understand that we're a mask-friendly environment. That's a little bit different than, and that really has to go, and we saw it a little bit, not too much unfortunately, but families and students who choose to wear a mask because that's their choice. We have to respect that decision and what that means, because sometimes other kids may not understand that. I mean, just like there's differences with everybody. I mean, like just because you choose not to, or whatever, so I think using the phrase mask friendly means that that's your choice. And to
Sorry,
your point,
I didn't mean to misspeak, but yes.
no,
Okay.
that's a new term that we're coming up with, but that's
Yes.
exactly addressing with what you were talking about, is that while, we're encouraging it, we're not requiring it, but if that wants to be your personal choice, then that's your personal choice, just like it's your personal choice not to, and just understanding that we're not going to discourage you from doing that, or there's something strange if you don't. It's just using that concept of saying it's okay either way.
Okay. Nancy?
Well, that was going to be my point, Lisa, so thanks for that, because, I do know families that they have several children, and their youngest is, not at the age 12 yet, and so the whole family chooses to wear masks to support their younger child. So I think that that's really important. And 12 or 11, where does that put? Is that 11, I can't remember, 5th grade? 12 is like 6th grade, or is that, is this middle school mostly effective?
Yeah.
11, you can start 6, yeah. Okay. Okay, so it could be some kids in middle school have not been able to be vaccinated as well. So I was just kind of all along just thinking it was just the elementary schools, but it does kind of bring it into middle school. So. But no, otherwise I appreciate all the work, and I appreciate the reminder of everything that was done last year as well.
Karen?
Yeah, so I also appreciate all the work that went into last year and the prep going into this year. And so I have like 5 or 6 questions. So,
Yeah, if we can start with one, then we'll go back around.
sure,
Thank
okay.
you.
So I guess my most important question is, how will the district handle quarantines this year? So if a student is sent home on quarantine, and my understanding is it's about 14 days, I believe this past year we were doing it as synchronous instruction, correct? So a teacher might be teaching some kids in class, but then there might be a kid at home in quarantine or several kids at home in quarantine. Is that correct? And how will we handle that in 2021-22 school year?
It depended upon the level that the student was at. It looked different elementary, it looked different middle school, and it looked different high school. So it varied, and we moved the quarantine from 14 to 10 days, if you remember when that recommendation came forward, February-ish, I think. Yeah.
Okay.
I'm looking at the principals because I'm like, so I think that was about the time when we moved it. So it was 10 days. And it wasn't 10 school days, it was 10 calendar days. So sometimes by the time the person was informed that they were exposed, it was maybe 5 school days or whatever. So one of the things that we put at for homebound instruction is we talked about that because we are not spending the money that we did having a separate group of teachers. So remember at the elementary school, we hired additional teachers to only teach virtual sections of students. At the middle school, our in-person teachers, the way that we organized it is that one of the sections was a virtual section. So if they were normally in a face-to-face and they got quarantined, they could jump on the virtual section. At the high school, we contracted that out to a service and to other teachers we hired specially. So the board invested last year a lot of money to staff the virtual piece of that. So we do not have the budget to continue to do that, to provide that option. So I'm going to go back. Kathy, can you go to the slide that says teaching and learning on it, 21-22? So you will see a couple things on here about homebound instruction or Canvas. And so those are 2 options to consider as far as how long the student is out. So the individualized plan is a matter of putting the team of teachers, so the student is quarantined for, let's say, 5 school days. The team of teachers is looking and saying, okay, in Fayad, there's nothing that they can do. We're going to wait till they come back. In math, easily, I'll have them do some synchronous instruction or whatever it is. So we have to build that plan around that student and looking at that individually. I can't tell you last year the answer that we did last year that if X, then Y, because we don't have a 2nd grade section that we can just put that student in for in 2nd grade anymore. We don't have a teacher. I also want to be very careful for our teachers that we're not asking them to continually be doing double duty. That's a huge burden on what that is. So one of the triggers question is, if it's 1 student, yep, we can do that. You know, what happens if it's 75% of the class that's out or whatever? Does that whole class then switch to virtual? That's the question. And we were able to navigate that last year when it became the tipping point. So we're aware that by having Canvas this time, that students who go out on quarantine have Canvas available to them, where and I called it parallel instruction, which is different than synchronous or asynchronous. So that will be available to them. And we will meet as a team when that student goes out on quarantine to decide what will be synchronous, asynchronous. The other variable we can't forget about is we're not sure what's happening at home. Will there be an adult home with them? Will there not be an adult home with them? So we have to take that into consideration as far as when they will be doing that. So that whole having an individualized plan when a student goes on quarantine is going to be key. And like at last year, when a middle schooler was on quarantine, you know, while they probably need some supervision, that's different than having a kindergartner go out on quarantine and having that. They probably are able to stay home alone, and they just jumped on one of the virtual sections of a teacher. That's not going to be the option. It doesn't mean that the teacher won't communicate with them, but I don't think the expectation is that every single day, every single hour, they're going to be able to be in a live classroom, because we just aren't set up that way. Did that answer, Karen, or?
I think it pointed us in the direction, so yes.
Okay.
So will we have a dashboard again? But what you're asking us, we were going to have one?
I think that's the question
The
from the
question, if
board
we want to
today,
have a
right? That's-
dashboard, and what
Correct.
information do you want to give, and
Right,
then what triggers we want to involve in them?
right.
And if we said, well, let's do what we had last year, would that work?
It would work for internally. Does it work for external? I think so. Are you still, is still that ICU rate being, I don't know some of that
Yeah.
external?
They're still making those reports weekly that I have access to, so I
Okay.
can still get that kind of data. Just to say, like, the red, green, orange, I'm not giving patient names or anything like that, but it's something that we can look at.
I don't know if the county will be producing those weekly case burden data also. That's the only, so the.
So we may have to eliminate some columns, you're saying, or?
On the external parts, I just don't know how often, like, the stuff that I got from the health departments was from Milwaukee County, where they said what the case burden rate was, what the R value was, and some of those things. Those were all external data that was given to me that I just put on that chart. I don't know if they're going to publish or still do those reports, but I can check on it. So I was, that half of the dashboard, I was dependent upon other people for getting the data from.
But ultimately, last year, we gave you the power to shut it down to do what you thought was right, with collaboration through medical advisory
Sure.
administration, right?
Correct.
And it seems to have worked. We stayed open, right? No one was seriously hurt. All good things, that's what we're here for, right? So I would be real comfortable with whatever additions or whatever you would think needs to be added or taken away to our dashboard to go under those same principles.
Yeah, to kind of respond is, I think that we can maintain our dashboards as we did last year. I think what's really going to dictate a lot of our responses is going to be our in-school case data, which obviously we'll have our own access to. But I think trying to figure out what those thresholds are, there's not medical data for it, but what makes sense to us, I think, is the best thing we can do. And I think part of that is so that everybody knows what page we're on. And that's what I think is probably the most important thing. I think we can, as a group, come up with something that sounds reasonable from our experience, from the things we know. But I think that having that set, and we can always change it. If it feels like, boy, we pulled the trigger to make Edgerton go completely virtual. Did that feel right? Did it not feel right? Or maybe we waited too long. So this can always be something that we go back and keep looking at. But I think that we can start at a point just like what we did with our red, green, red, or red, yellow, greens that we did before that. It felt that it made sense to us, and this was something that gave us information that we as a parent would want to know, like where's your barometer for how many kids you want to have sick in the class you're sending your child to.
Right, but I think I heard Lisa say that some of the success we had was because we didn't go by hard and fast numbers, right?
That is correct. I think when talking with the principals, because all of them at their buildings, if I would have said, if 10 staff are out, you have to close, like that was different at each of them. And it depended upon which 10
Right.
staff are out, so
Right,
correct.
and if we can
Right.
replace that individual, and so
Correct,
we need
yep.
flexibility.
Yeah, and we can probably do the same red, yellow, green within a range of numbers kind of thing, saying, okay.
Kevin, anything?
I got the hand wave.
I'm here. I don't think I have anything at this moment. I think we do need to still stick with some of the similar metrics, because if all of a sudden this starts blowing up, not that it will, but you never know, having something that can tell us when to shut it down. But I think, Lisa, we need to provide some direction to Dr. Olson as far as, like she said, is that shutting down, as far as the load on teachers when it comes to that synchronous learning, if it's 50% of the class or what percentage it is, try to provide some type of guidance on that. But I would defer to their expertise as far as what they find appropriate in that matter.
I agree. I think keeping the current dashboard with whatever metrics are available that we can share is good. And then at the same time, deferring to the administration to really give their recommended limits of, okay, this is, if we reach this point, this is too much for us. And as Dr. Olson had indicated, it's different based on each school, and they're really the experts on what they can handle, what type of stress they can put the staff under. So I'd be fine listening to what their recommendations are and going forward with those.
Nancy?
I agree with what Jesse says, but I do think that a once-a-week dashboard would be plenty. I don't think it has to be 2 times a week anymore.
Okay. Does anyone else have any other questions or comments at this point? I know Karen has a couple. No, I know you do, but I don't want to, if nobody else does, I want you to be able to.
No.
I can
go
wait
one
till
after
she's done.
another.
I'm fine.
Okay, all right, go ahead.
Okay, so I guess my second question is back to that homebound instruction and quarantine instruction, and this is for last year and also going into next year. Is like, how do we evaluate the effectiveness of how we did for the homebound and quarantine instruction, and then getting back to the quarantines going forward into 2021-2022 school year? So if we have some kids who are quarantining at home, and if we have some kids who are in the classroom, what's kind of unfortunate is that the kids who are at home are kind of at a disadvantage being at home. And in this past school year, we've sort of dealt with it saying, you know, those are the circumstances we are in, you know, it's not perfect, and we're just going to do the best we can with the resources that we have. But now that we're going forward, I guess the question is, how are we making sure we're delivering what the kids need at home, whether it's in quarantine or during homebound instruction for kids who may have more compromised health situations?
So there was can you repeat, Karen, the first part? There was 2 parts to that you talked about.
Yeah, so I guess my question that I'd written down was, how do we evaluate the effectiveness of our homebound and quarantine instruction? But then I guess my question is really about, how do we ensure that the kids are getting what they need when they're either on quarantine or at home? You had answered that a little bit before about how your team's going to work together with the individualized plans. Mm-hmm. So, but I guess what I'm getting at too is, like, vaccinated kids can stay in school, but kids who are not vaccinated might be sent home and might be missing more school and might be at a disadvantage. So I'm just trying to address that.
Yeah, and I would say, you know, as Jackie and I have talked about this, because homebound instruction has existed forever.
Uh-huh.
So whether it's a student who breaks a leg, and whether the instruction they got when they were sitting at home with a broken leg was the same as if they were in school, we can all say probably not. And so nobody chooses probably the situation that they're in for homebound instruction, whether that's a medical, physical health, mental health, or whatever that situation is. What I would say is the way that districts typically, including Whitnall, provided homebound instruction, which was more hard copies of materials, and here's the book. We might sometimes have someone visit their house to check in with them. I think the ability to do that now virtually, potentially have synchronous instruction, have teachers meet with them virtually, is 100 times better for the student than we've ever been able to provide before. When you ask about how you measure the effectiveness, I don't know. It's giving them a book and saying, I'll see you in 3 weeks, versus, hey, you can connect with your teacher and you're going to be maybe watching your class live and you're in Canvas. Like, that's just some logistics that, of course, you're going to stay more engaged. if you're saying is their test score or their grades better, I don't think you could ever prove that that was because they were or weren't on homebound. But what we can say is that the quality of what they're getting now because of Canvas and synchronous instruction options or asynchronous instructions is more likely to provide engagement and keeping much closer contact with that student versus I will check in with you once a week or 3 weeks when your homebound is done and you can return to school. So, you know, we get feedback and we know it is an individual situation. A child who's at home with no adult versus someone who in a homebound situation, again, it doesn't matter if it's a broken leg or not. It's a holistic picture of what supports they have. Does that student have an IEP? Do they have a DEP? Do they have a language barrier? So it's hard to say the effectiveness because it is very individual. We have that team of people look and say, are they completing their work? Are they doing it successfully? So that's part of that whole process in evaluating that plan for homebound instruction for that individual student is working. And if not, we will adjust it. If the student isn't engaging, that those teachers say, this student isn't engaging, we need to come back and revisit it. This isn't working. Why is it? Well, that's because there's no adult at home and nobody's, so we need to get the parent more involved in it. So it may not be the answer that you want, but it's an individualized approach to what's working for each child and their circumstances.
Okay, thanks.
Yep.
How will close contacts be notified this year? Again, so we've got the situation where some people might be vaccinated, some people might not be vaccinated. The schools don't know who is and who isn't. So will that remain consistent with last year?
So there is a statewide database of vaccinations that public health departments can access. And last year, as I shared with the board, school nurses are also able to access that database from the state as far as vaccinated school-age individuals, as far as the contact tracing. So before it had to go through the public health department to determine if someone was vaccinated. I mean, we can ask someone to see their vaccination record, but it's easier to be able to look it up when we're doing, when the contact tracing is happening. We've not had, we have a meeting next Tuesday with the public health departments, a midsummer check-in, if you will, on where they're thinking and what they're looking at as far as the data when we ended at the end of the school year. I mean, again, we're talking, 2.5 months before they come together, what they're seeing for contact tracing and what that looks like. But as I shared here, we will continue to assist them in whatever manner. It became unmanageable for them before, so we assisted with that. But ultimately, contact tracing is the responsibility of a public health department, and they asked for our assistance in that. So I don't know that I can give you the full answer until I talk with the public health departments and what they're thinking for this school year.
Okay, thanks. How does the district enforce the idea of stay home if you're sick?
What do you mean? How?
So as one of our preventive measures, I think it's on one of these slides, our mitigation efforts was, telling families, please keep your kids home if they're sick. And so I wasn't sure if there is any enforcement of that at school. Do we send sick kids home? What does that look like?
Last year, there was guidelines that came if they were COVID-like symptoms, and so with the list of symptoms, if there were 3 or 4 more, the DHS recommended that they be sent home. Typical years without COVID, because this happens with anything, if a child is sick. So when a parent calls in an absence, and we typically follow up what symptoms, because if we're starting to see it looks like strep throat is going around, it looks like the stomach flu is going around, and sometimes we're able to talk about that. So I think we've always said if you're sick, stay home, COVID or not. Last year it became a little bit more prescriptive because of the symptoms that they were looking at. But anytime a teacher or anybody notices a child who's very sick in class, we would send them to the health room, and the nurse, health room aide contacts their parents and say, your child is sick. They say that they've been sick. They said they threw up before they came to school today. They probably should have not come to school. And they could have said, no, they ate something. There's a lot of things. So, we always encourage, if you're sick, to stay home.
All right, thanks.
Mm-hmm.
I will go around one more time. Kevin, anything?
No, I don't have anything else.
Is there any information you'd want them to provide before the 26th to help you make a decision?
No, I think most of this is pretty cut and dry. I don't know how much you can enforce some of those things, like Karen was saying, as far as who's sick. I think at this point, if your child isn't feeling well, I think we're almost in the culture of the community and the world where if your kid isn't feeling well, you're not feeling good to go to work, you just don't. And you take the necessary precautions. But I think everything presented makes a lot of sense. And assuming nothing crazy happens, I think we're going in the right direction.
Okay. And same questions to
Good.
you. Anything you want before?
I'm
Okay.
good.
All right, Stephen?
Just kind of like my comments on the plans so far is, I personally really like the cohorting and the ability to not necessarily isolate, but kind of keep grades, I don't want to say it's contained, but have a way of keeping those students in groups and stuff so that we can make actions in the lower levels that are limited to either a single classroom or a single grade level as much as possible to not disrupt the rest of the school. I know that becomes a lot more difficult the older kids get as classes mix around a lot more. But again, keeping up with, our ability to contact trace and things like that, I think are gonna stay an important thing. Again, as kids get older and mix more, they're also at the vaccination age, so hopefully it's less of an issue. So hopefully those kind of like cross at the right place to minimize that. But I think that's something, especially in the lower grades, I like being able to keep an eye on that, and being able to limit anything that we have to do. Like I could even foresee a single classroom having to mask for a 3-week period of time until everything kind of clears through that. So that I think we can be flexible to that point to keep the buildings open and to kind of minimize what we have to do for kids. It's like I want to keep them here, I want to keep them learning, but I don't want to necessarily have other mandates that go on.
Okay. Jesse?
I think the information's pretty straightforward. I don't have any other requests.
Okay. Nancy?
I'm good.
Karen?
Yeah, back to what you were saying, Stephen, I just want to clarify, because the way I guess I was thinking about the triggers was, the triggers really for in-school or at-home learning, and I wasn't thinking about the triggers as masks on or masks off. I was thinking about it being mask optional for the entire school year, but then the trigger point being at school or, for some reason if things get
So-
serious in terms
Sure.
of, staffing or a lot of people being sick, then moving that learning to at home. So were you saying that there might be a trigger for masks on or masks off as well?
It would certainly be something I want to discuss, which is why I bring it up. I think that, the two things that help the most with spreading this respiratory illness is wearing masks and being separated. There's only so much separating you can do in a classroom or lunch and things like that. But masking is one of the things that's been shown to be effective. I know, I can't wait till I don't have to wear a mask at work anymore. But, at the same time, I think there's a reasonable level of, if you're starting to see, 1 kid sick in a classroom, 2 kids the next day, 3, it's like, okay, what, you could, instead of flipping directly to virtual, you can say, hey, we're gonna mask and see if that contains it, rather than having the kids at home and without their teacher live in front of them. That could be an intermediate step. Again, if you guys don't think that's important or a viable thing, we don't have to do that, but it's certainly something that could be optional.
And let me ask, when the district puts it out there as possible triggers, how does the district mean that in their presentation to us?
Well, if you notice, that's Liza's discussion. Everything else is recommendation. We don't have, so going back to what we did last year when there were decisions that were made, the way that we did that, truly the trigger that happened is we have no teachers to cover our classes. That was really the trigger that was used last year. So I put that out there for the board to discuss. If the board wants to have that, we have no recommendations on that slide. We are not recommending what that is. If it means at a certain point that the medical advisory committee starts meeting, and that the committee would have that. I would not, on my own, I'm not comfortable with adding that precautionary measure. I'm comfortable switching or closing because I know what our staff is. So I think at that point, if we're getting to that where we're seeing some case data and the medical advisory committee would recommend that and stuff is changing, that I would want to come back collectively to the board at that time, where literally the staffing thing was a day-to-day, hour-to-hour situation. We were in a pretty critical situation when we did have to close right there at Thanksgiving. So that is something where to add a precautionary measure would be something that I wouldn't want to make alone. So whether or not the board wants to set a trigger point when it gets asked for that, or you're just saying on that monthly report that I'll be reporting like, hey, that's where it is, and then we can revisit at that time. So that slide, if you noticed, had the word discussion. Everything else had a recommendation on it.
Okay, so just to recap, what I'm hearing is that, if I've got this right, you're saying that you're comfortable making the decision with the medical advisory committee about whether the learning model is in person or at home, but not so much for a mask requirement.
Right, looking at where the data is, whether or not, and again, our primary thing was with staff.
Mm-hmm.
The case data was, while the case data for students was higher, it was the quarantines that were pulling the students out. It was not, and the same thing honestly was true of staff members. So understand now that we do have a majority of staff members who've chosen to get vaccinated. And the quarantine also went from 14 to 10 days. So there's different variables than there were last November in place. So again, criteria and things changed and evolved throughout the year. So at that time, the number of students being out versus staff, and so they all were getting the same education. Last year, there was never like, hey, we're gonna start disinfecting every 5 minutes, because that probably would have cost us adding more custodians and all of that stuff that I would have had to come back to the board for, because I would have not wanted to make that decision alone. So the educational learning environment one, I'm very comfortable making. Precautionary measures, whether it's disinfecting or masks or whatever, I would want to come back and add, because I think that that's something that's, I mean, my arena is education and learning.
Thanks.
Okay. Anybody else? Anything before we move on?
I guess question for the group as a whole, do you want to have a trigger for masks? Because that's, I would hate to just bring it up and vote on it next time without knowing. And if that's the feeling, I could come up with some points. It would be out in the packet ahead of time so you would see it. Is that something that people have any interest in? Do you want to just see the numbers and think about it?
Well, my suggestion would be that, again, not to be hard and fast on it, but to, whatever communication we do send out to parents, that is an option, depending on where the numbers go, if they go somewhere that we don't want to be, or staff, that we could go back to mask mandate.
And it could be that we'd be superseded by the county pulling it anyway. You never know. But I think that, to be fair to Dr. Olson, I think if it's something we're interested in, rather than making her have the decision and have to interpret stuff, we would be doing her a favor to kind of set some stuff so everybody knows what the playing field is, rather than, oh, today we feel like it, tomorrow we don't. So that people going into it know what it looks like. They would know, maybe that would be a reason someone else would get vaccinated because they don't want to have that be another trigger. There's lots that can go into it if everybody knows the rules ahead of time.
I think we've, even this past year, we've offered a tiered approach.
Mm-hmm.
I think potentially going to masks for a week or two versus shutting down an entire building for a week or two would make sense,
Right,
if it's an option.
right.
And again, it wouldn't be, we set it in permanently for the rest of the school year, but I think we should look at the least obtrusive option before we go to shutting down the entire building. That's just my opinion. Anybody, any thoughts?
I don't know, I think I'm kind of the other way. Like, I think that if the parents know, let's say that there's a classroom of 25 and we have 5 kids that have tested positive or something, and the parents have been aware of this, that it should be up to them then to say whether their child should wear a mask or not at that point. Like, I think I would probably leave it up to the parents at that point rather than us mandating that all the kids now have to wear a mask.
At any percentage?
Well, you know, I mean, I think if we have 50% of the kids out, I don't know if we would hold class. Like, I don't know what it is now. Like, if kids have the flu and how many percent are out of a classroom, what happens then? Like, I don't know enough of that to be able to make that decision or even a suggestion. Like, I know that you were really good at communicating with the parents last year, and I know the parents all appreciated that. And, you know, I think it's at a point now where, especially with the older kids, you know, maybe the younger kids, it's going to be different. Well, although the vaccine should be available in October, and then things will be even better. But you know, if they want to take their chance of their child being infected, then it's kind of up to them at that point.
I agree with Nancy, and I think that, you know, if things were to get crazy, you know, let's just say, you know, things happen and there's an illness that comes through, I would be more inclined to entertain having an emergency board meeting if we get to a situation where we really need to talk and make some quick decisions about things, and if we have, you know, like a severe circumstance. But outside of those conditions, knowing that, you know, our numbers in the area are going down and more people are choosing to be vaccinated and those kinds of things, I'm more of the mindset that we leave it with the parents to decide.
Kevin?
Yeah, well, first of all, am I on camera, like, completely everybody can see me?
Yes.
It would be nice if you'd explain that as to why I am where I am, not just I'm virtual. I'm at scout camp, everybody, so in case you're wondering why
I thought it was a
have
tavern.
a lot of things going on in the background. What?
I thought it was a tavern.
Yeah, it'd be interesting if it was a tavern. So you see me looking various ways. I'm in the staff area using their internet. So yeah, and this is a scout shirt in case you're wondering why I'm looking a little bit ridiculous. But
Could you
anyway.
stand up?
Anyway, no, I think Nancy has a good point about the masks. I mean, are we going to put a measurement? The only way I could really see at this point is if one of these variants goes crazy and essentially becomes the new thing that we need a new vaccine for, to the point where we're going to have some sort of metric for masks. I don't know if there is something that we're going to need. I mean, if it got to that point, kind of like Karen said, where, oh my gosh, something's blowing up, obviously we're going to need to do something. I don't know if there's anything we need to put a metric to that's going to matter, because if we've got half the kids out, half the kids are okay. I don't know what the masks are going to do at that point, but yeah, so.
I agree with the previous three. I think we have those online pieces in place for a reason, and it sounds like we have come a long way with those from the beginning of when we started, and it seems like it's a very easy transition to go from that point. Again, I would love for kids to be in schools, but I think the message kind of gets skewed of, okay, under the understanding that, yep, it is a mask-friendly environment, but it is not a mask-required environment. And, I mean, you can't make everybody happy, but going into the school year with the understanding that, yep, you can do masks if you want. If you don't, and you have the proper vaccinations, do what you need to do. But trying to put metrics down for each and every school and determine what's good for each classroom is kind of a lot of tenuous work that I don't think I'm equipped to make the decision on.
So are we able, with the staff that we have, would we be able to flip to virtual
Sure.
with the
Yeah.
staff we have?
Yes, yep. So we talk about inclement weather. If it's
Right.
like the third snow day in a row, we're going inclement. Everybody's doing it. It's this like in between that because like you got some in person, like that's so we can do all one or all the other. And individual cases, we can support the best we can, but we couldn't have did what we did last year if we had not had the additional staff and contracted out. That would have never been a possibility, yeah.
Okay, great.
Like, I appreciate Stephen's perspective because he sees this all the time and, you know, and we don't. I just don't feel like I'm equipped to be able to say, like, if 7 kids are positive, then they don't have to wear masks, but if 8 kids are, then we have to require masks. Like, I don't know what those thresholds would even look like. So that I'm just kind of in the camp to leave it up to the parents
No,
at this
it-
point.
And that's why I
this
brought it
point.
up. It's like it's out there. I want to make sure that if we're going to do this, we can prepare for it. I didn't want it to come up in 2 weeks and say, oh, well, we didn't think of that. So again, I'm just trying to kind of like push anywhere to kind of see how far we want to go in any one direction. So I appreciate the discussion. Thanks.
And I would say that we will, you know, we are in the same mind at the district that we will encourage vaccinations to anybody who is eligible. And to Quinn's point, it needs to be important that parents understand the risks if they have a child who's eligible and is not vaccinated, because we don't control it. That is not I want to be very clear, that's not a decision that the school is making to be quarantined or not. That's coming from the public health department. So if we are doing contact tracing and have been exposed, and if it's an unvaccinated person, the school district does not quarantine them, just like we did not quarantine people. We helped the contact tracing that was coming through the health departments, and that would be the case this year. But the circumstances that still exist from the public health department is if you're not vaccinated and are exposed, you will need to quarantine, and we will support them in that decision that they are making for public health. So I do think it's important that whenever this gets communicated, parents understand if they have a child who's eligible and are not, that is a risk they might need to have through contact tracing. And, you know, we're hoping October early that it becomes eligible for others. And that's the other part to say, like, what percentage of those students choose that and what does that mean then as far as that. So I think that's that information. We did not have vaccinations available that last November when that decision had to be made. So it was a matter of the number of people that were out for quarantine. And had the vaccination been there, obviously those people wouldn't have needed to been quarantined, and we would have been in a very different place. And so we're working with some different knowledge here, but it is it's changing because the vaccine isn't out there. So we will continue to promote getting vaccinated by everybody who is eligible. That includes staff also, if there are that are any or not, because they would also need to be quarantined, and there's not, you know, some of the other federal compensation that existed last year for people who were out because of that, because now it's a choice that people are making, so.
Okay. All right, so again, this will come back in 2 weeks for discussion and action. So thank you. On to B, student handbooks with the principals.
Did he leave? Yeah, he knew handbooks were I don't know, so, y'all can start off for me. I don't know, you can just talk back here, I think, if there are board member questions on this. This is an annual situation that we do, and we have to approve them before we ask our parents to start doing the registration for the new school year. So obviously, there were changes put in the handbooks due to COVID procedures last year. We've taken those out, and so this is your chance to ask any questions of the handbooks
So one of the things that I noticed when I was looking at the elementary school handbooks is in the HCE one, well, both sections of student fees. In the HCE one, there was an extra fee for 5th grade clubs that I did not see in the Edgerton one. Is there a reason?
So historically, HCE has had an intramural club for 5th graders, and that was pre-COVID. It's always dependent upon staffing, so it is something that may exist, and so that's why we've had it in there. When I arrived as the principal and Chris was over at Edgerton, Edgerton did have that same intramural club, but staffing was lost at Edgerton, and so they didn't have staffing, and so they didn't have the club.
What's an intramural club?
Oh, it's quarterly. There was a different sport. It was typically at HCE run by or led by Bill Rogan, and so they would do like flag football in the fall, volleyball, basketball, and a soccer, and they would do it quarterly. So that's all it was. So. So Meg wouldn't know anything about it because it existed pre-COVID, and so she didn't know about the club.
Gotcha. Okay, fair enough. I have the previous one. I could. So there isn't a difference in opportunity of the two schools.
If we can staff it, it happens. I don't know what the staffing interest will be, and we needed to kind of know how we were going to reopen to even inquire about staffing. So we haven't done that inquiry yet at either of our schools.
Okay.
So could there be a difference? Yes, if one school has it staffed and the other doesn't, then that could happen.
I'm not certain if Greenfield Park and Rec would provide services for HCE, but they did for Edgerton.
Yeah.
And so I would, I like this. So I would say that in some cases, you know, Greenfield Park and Rec with the staffing that they had could provide additional opportunities that maybe the other school didn't have. So I do think that would be important for them to investigate.
Gotcha. Thank you.
So I just have a general comment. So, you know, I started to read through some of the handbooks, and it just got a little overwhelming to read every single word on all of the handbooks. But, so just a general comment is that I think that they should look similar. Like, I think that the elementary handbook should have all of the same information, and it just should be Edgerton information in one and Hales Corners Elementary in the other, so that the items, the sections should be the same.
Same format?
What?
Same format?
Yes, same format. And then I just thought that the high school one, and then the middle school has a lot of information on that I didn't see in the elementary handbooks. And the high school looks completely different. So I would just kind of like to see them look more similar, but that's just that would be my choice.
Just to back that up, I agree 100%. And I know that these things are right now, that happens, you know, we work on things and they get a little bit different, but I know that we've got the capability to do graphics and make our documents look nice and to see some district branding across all four, and then also to do a little bit of content review between the student handbooks would be good. I mean, we have thousands of families that, well, not thousands of families, but we have a lot of families that refer to these documents, and so to have them be just kind of polished and professional, a little bit more than they are now would be great. I do have several other things, so.
Okay. Kevin, do you have anything before I let Karen go with the questions?
No, go ahead.
Okay, so I did notice that in, I think, all of the handbooks, I really noticed it in Edgerton, but when we talk about immunization requirements from the state, there is not currently a mention of vaccine waivers. And so a mention, I looked at the Wisconsin State Statute number 252.04, Part 3, which says anytime at any school notifies a parent, guardian, or legal custodian of the immunization requirements, it shall inform the person in writing of the person's right to a waiver under this subsection. So as I understand it, if we're talking about these immunizations are required, that there should be a sentence in that section that also mentions that parents may obtain a waiver. So if we could please take a look at that, that would be great.
We're just trying to see if it's in the separate parent notices stuff, that they get
And
notified.
it might be, but I'd still like to add that since we're talking about the immunizations, that the waiver is mentioned. So that's
Well,
my,
then we'd have to go and take all the parent notifications and put those in for every place where they do. That's why the state and their policy says put all the parent notifications like in one place, because we send those out to parents, like here's all your notifications of where the curriculum standards are, immunization, your waivers, your rights, and all of that. So we've been directed that all parent notifications go together, so it's easier for parents to navigate rather than trying to find them in like a million different documents. So it's a parent's right document that we have to provide.
There's not currently an annual book that specifically talks about immunization waivers.
So you're saying pull it out of the form, because it is on the form. Jackie, is it, I think it's on the immunization form, because there is a place where you can check what your waiver is. So you're saying you want it outside of the.
well, it's saying I mean, I think we should look at the state statute and just make sure that we are doing what it says. So we're talking about immunizations, and the waiver is part of how that works, is you can do your immunization requirements, or you can file a waiver. So I'd prefer that to be clear in the handbooks, please. Yeah, that'd be
It's on
great.
the form, but
The other thing I'd like to take a look at is video surveillance is mentioned in the Whitnall Middle School handbook. It's under video monitoring systems on page 30. And it basically says something to the effect of, there's video cameras in the school, you know, and so you're aware. Now, this might be a notification thing too, I'm not exactly sure. But I was looking at one of our neighboring districts' handbooks all of our schools, as I understand it, have video cameras, and that video cameras are part of, you know, school life, and that if we're talking about a handbook that talks about conduct and discipline and things like that, that we let everybody know that there's cameras, and that's just, we're really above board with all that. I don't think there's any, so anyway, New Berlin's school district says, to maintain the health, safety, and well-being of all, our campus is routinely monitored with video surveillance and inspected by the police and fire departments. And so I thought that was some good language that, and if it's in the middle school handbook but not in the other handbooks, I'd like to have a look at the consistency of that, please.
so is it in the other handbook or not? I don't know. I just want to first correct that.
I looked and didn't see it.
Yeah, so as Kathy said, it is under the annual notices to parents.
Okay. But it was in the middle school handbook, so that was just weird to me that it wasn't across the board.
Again, I get the consistency, I just
Yeah.
want to make sure that we're like, we're also trying to, we have an obligation to parents to provide the annual notice.
Oh, sure.
They don't have to go through every single handbook, they can like go to one spot too, so it's a matter of if we duplicate that in there or have it all in one place too, so. So the answer is, you don't think so? Okay. Yeah, it is in board policy and parent notifications, I guess. Her question was, is that the middle school called that out on top of all of that, and the other three did, and because it's consistent across all of our districts, what we do for that, just they're calling it out differently in the middle school handbook.
I have one more, but I can wait if anyone else has something.
Anybody else? Okay, go ahead.
Okay, so the next thing I wanted to ask about was the dress code. And so I know that the middle school dress code and the high school dress code are quite different when I looked at the two handbooks. And so I wanted to ask why that is as a first thing.
Made a couple of adjustments to our dress code based upon some discussions with students this year. We do have a student group. Because we had talked about having a student group involved with some of those decisions, we did not make additional changes as of yet. However, there was some discussion of taking a look at the high school and the middle school dress code and making them the same. A little bit more general.
Yeah.
Probably moving more towards what the high school has.
Okay. The high school is a lot, I mean, there's a lot more requirements at the middle school level than at the high school level. And so I was starting to wonder, well, do we have different expectations for middle schoolers than high schoolers? So yeah.
In talking with Mr. Tollefson as well, I think our expectations are actually quite similar. In one place, it's outlined more specifically, and but as far as expectations for students, they're quite similar in both places with a couple of exceptions.
Okay. And then the only other thing, let's see, where did I put my note on this? There was a note about like, I think the high school is looser on hats and headwear, but I didn't see something mentioning like for if it's medically required or for your religious observance about being able to wear something on your head. So, but I think the high school is looser about that. So, I just wanted to have a quick conversation about those things.
Yeah, 2 years ago now, I think it was, we had a committee of teachers, students who reviewed our cell phone and dress code policies. And at that time, the decision for hats and hoods to be enforced, it was determined that that was, I guess, unnecessary. It didn't really affect the education learning of students for a student to wear a hood in classroom. It falls under our dress code policy of if it becomes a nuisance. So if a student is wearing a hood backwards, so their whole face is covered, obviously that's a nuisance to learning. So that's where we take some judgment on the dress code, and I think that is why our dress code follows just the board policy and AG for dress and grooming, and doesn't really specify those specific scenarios. I think we've also seen in the state of Wisconsin with recent legislation or recent judicial rulings that there's freedom of speech that's somewhat guarded with dress code. And so we obviously don't want to come out right and say you can't do certain things that may or may not be protected speech. It really comes down to an individual situation and individual scenario.
All right, thanks.
Okay. Anybody else? Do you want to? Kevin had a question.
Yeah, I'm here. Can you hear me?
Yes.
All right. I just had a question for Chris about the middle school lunch periods, because I can't pull it up right now because it's not loading because it's on page you know what. But I think like one of lunch periods there's like 10:39 if I'm correct. And I was just curious how that all factors in, because I think there's a break for lunch periods from like 12 to 12:30 before sixth grade goes. And can you kind of talk on how that affects our kids, especially if you're eating lunch at 10:30 and then you might not have your next meal till 5:30 or 6?
The eighth graders are the ones with the earliest lunch. They have 3 instructional blocks, then their lunch. The seventh graders have the four instructional blocks and then their lunch, and the sixth graders have 5 instructional blocks and then their lunch. It really has to do with the schedule. Our instructional blocks are all equal minutes. The change this year from the past 2 years is a few minutes that were. If you look at the end of the time periods, because we're ending our day 5 minutes early, we just backed literally every schedule up by 5 minutes throughout the entire schedule. In talking with the teachers also, both for the sixth graders and the eighth graders, I know the sixth graders have like a planned snack time in the morning because they have a very long period of time before their lunch period, and conversely, there is an option. Now this year we're COVID restrictions and so forth, but there is an option for the eighth graders to have a snack in the afternoon. So it mainly has to do with the schedule.
So Kevin, maybe I can elaborate. If you remember when we changed the high school schedule, which we've not yet implemented because of COVID last year, they had a similar situation when there were 3 lunch periods, and that middle lunch period, kids were going to half a class, then going to lunch, and then going back to that class. So anytime you have 3 lunch periods, like you have this weird situation. And so at the middle school, they're not like separating that class, they're doing the whole class period, and then they're going to lunch, where the other option where the high school was doing it is like they were going to half the class, having lunch, and then going back to half the class. So that's a very comparable situation to what the high school was in before with that 3 lunch period situation.
Yeah, I guess my whole thing was just, like I said, the timing of it. Like, I get it works within the schedule, and that's how we kind of got to go about things. But whether or not there's any grace given if some kid starts eating at like 2 o'clock, pulling something out and having a snack, just because it is a big gap, especially for kids that are in middle school. It was just something I had a thought on. So
Okay. Anybody else?
thank you, Chris.
Oh, no problem.
Anybody else? Okay. Then on to 5, student assessment, student achievement.
Good evening, everyone. I'm here just for a quick report. I'll take a step backward before we go forward, but I just want to, a few months ago, Dr. Olson and I had presented to you the idea of coming every month with an assessment, a student achievement, a report, just letting you know where we're at with assessments. As you know, assessments have to be given, and then there's a processing time where we get information back for individual students prior to the larger data being released for public knowledge. And so what we've been doing is working behind the scenes to provide an update for you on our student assessments. And so tonight what we have to share with you is this document. It's called July Assessment Report. This is in your board packet. In here you will find a couple helpful links. The first one is to the presentation that was originally shared with you about this topic, and we had then shared ideas of the templates that would be used. The second one is just to the assessment website that we have for all families to look at. We'll keep that updated. And then the third link is really under the monthly assessments, and that's really each of the phases defined. Previously in the presentation, you had seen much of this information in a bulleted list. What we did is we just put it to phases so that you could easily track like our progress throughout the assessment life cycle. So that's what I'll be talking to tonight. I don't have much to share. It's very brief. But the biggest idea is that Wisconsin Forward, Dynamic Learning Map, ACT Aspire, much of those data pieces we have individually, depending on the assessment. Sometimes the assessment is automatically communicated to the families, the individual student reports. But right now in phase 6, what we're really focusing on is making sure that we get that information into our student information system, Infinite Campus, and then we're working on doing any drafts of sharing the individual data with families. Some of our other every assessment's at a different spot, but you know, they're kind of lumped together. So you can see our access assessment, which is our English language learners take that assessment every year, and it really assesses their language levels. And so this one we are still waiting for data to come back, and so that's really at phase 5, where the assessment window has closed, but we don't yet have data. And you'll see a few other of the assessments are like that too. As we move forward, what we'd like to do is come back to you with a report and say, hey, we've moved forward from phase 6 to the next phase or wherever we're at. As a reminder, I just want to share that some of the data, most of it that is from the state assessments. We really don't have the freedom. We can use it internally, but we have to wait till the embargo is lifted before we can share it publicly. So some of that, it will be a little bit, typically, fall at some point. But as we have each monthly report, we'll update you on our progress. And as you can see in our progress, we want to update families and communicate to them on a regular basis, and then make sure there's helpful tools on the website. So this is where we are at for the first report. Is there any questions or?
You're just waiting on data.
A lot of it, yep.
Anybody?
How long is the usual embargo period?
Typically till fall. I mean, in the past, it's been like October, November, but this year we haven't even talked about some of the possible dates.
So right now, I'll give you an example. Individual forward test scores, we have individual ones. And so we can pull them down one at a time. And we can collectively look at ours, but it's not from the state. So we won't have any idea what the state average was or how other districts did. So the embargo data is when the state gives out all of the data, how your district did, what the state average is, and how all other districts did. We can internally start to look at that, but as far as, did every district do better or worse, or where did, we won't have that. So we can compare in a narrow, and we can see how individual students did, and to decide by an individual level, like that's where that student is within a group, but we won't have the larger comparisons like a state average to look at. So that's what we have for a couple of the assessments right now.
But there's plenty to do. We got to get in our student information system, communicate, make sure that we have tools and resources for families to access to really understand the information. Any other questions?
Kevin, any questions?
No, nothing for me.
Okay. Anybody else? All right.
All
Thank
right.
you, Jen.
Thanks.
Okay, on to 6, board member information requests.
You can start.
Okay, so I wanted to ask for a future discussion item, and that is, so the board could discuss the possibility of adding a semester honor rule for middle school students and high school students. And so whether that comes through something that would be in the handbook or whether that would be a board policy. But some schools in the area have honor roll and high honor roll to recognize students for academic achievement. I don't know if Whitnall has ever had that, but because the board takes an interest in recognizing and celebrating student success, I'd like us to look at that for discussion.
Anybody have any thoughts on that?
Well, I know
Was the
that,
question to have an honor roll or a high honor roll?
Yeah, to have an honor roll system each semester.
Are we not currently doing this?
Do you want the principals to talk to it, or?
Charlie, do you
wanna
want to,
come up,
Charlie,
Charlie?
Chris, do you want to?
I know we had some changes when it came to like class rank things, but I didn't know if this is something that changed recently.
I was gonna have you just stand and be, I don't know. Yeah. At the high school, we do have high honors awards at the end of each school year. Students can then purchase chevrons and things to put on letter jackets or academic letters. Kevin's correct, we did change board policy to move to a Laude system, and this upcoming graduating class, the class of 2021, will be the first class to go through the Laude system.
2021 or 21, 22?
22, thank you. I'm still not there yet. But yeah, class of 22 would be the first to graduate with Laude system. So we did go through our recognition process to identify students who are 3.5 GPA or higher. It's been a couple years since we did the all-school assembly, but typically at the all-school assembly, there's the high honors recognition. Students are recognized at that point. But to my knowledge, we don't do any sort of publication of that. That's just has not been our practice, and I don't know if there's any concern of privacy for a student to not want their name published out publicly.
I mean, mine can be really simple. This past year, as you know, was my first year at the middle school. We did change our grading practices to basically now go along with the high schools with the A, B, C, D, F from what type of grading system we had before. No, there has not been, at least not to my knowledge. I'd have to go back and look in the history books a little bit to see if it's been done at the middle school or not. I have been in discussion with a couple of teachers who are interested in taking a look at some systems to honor students. And so not specifically to that, Karen, but it is definitely something that we can investigate.
Yeah, so I guess what I'm asking for is for it to be a board discussion item. So I appreciate the information, and I guess what I'm asking for specifically is that we discuss a semester system rather than an end of the year system, and that would include, so that we talk about it.
I think that was just they came up,
Yeah,
there was
oh,
a
yeah,
follow-up
yeah.
to
Oh, yeah.
Kevin's
I get
question,
it.
not specifically to.
Yeah.
Anybody, any thoughts on that?
I would be interested. I think that student achievement is a good thing, and honoring, the privacy thing, do we, at the end of the year when they get their cords and things at graduation, do kids opt out of that? If they do,
Yep.
they have the opportunity to do that?
Yep.
Well, then they would have the same opportunity at mid-semester, so. I know the universities do it.
I guess the only thing I would add for a discussion, it'd be nice to have a surveyor know what's done regionally, just as an idea of what's out there. Not that that should have a whole lot of what we do, but getting at the people's experience perhaps.
Anybody else?
I think any opportunity to recognize our students is a good thing.
Yeah, whichever way we go about doing that doesn't really make a difference to me as long as we do something like that.
Kevin, any more thoughts?
No, I have no issue making it a future discussion.
All right, you have it jotted down, Kathy? Okay, we've got that. Anybody else?
Yeah, we received a lot of requests, emails from the general public altogether, and I know in the past we've put together like presentations for people who wanted to pursue possibly becoming a board member, but I don't feel like we have anything out there for people to get a general understanding of how all of this actually works. Because we absolutely want to help people out in whatever way that we can, but we have a specific set of ways that we go about doing it, and I don't feel like there's a good understanding or piece of education out there for people to understand, okay, this is how a board meeting functions. If you want to get something conveyed, this is what you have to do. If you want to speak at a board meeting, this is the understanding that it has to be on an agenda item. It has to meet this criteria. I think there's not a resource out there currently that explains that well enough to people so that they're not wasting their time sending us things and then them thinking, okay, this is going nowhere, when it really needs to go through the correct process, or if they really want to bring something up, how to go about doing those things.
Okay.
And I don't think having an in-person thing would be the best way of doing it based on turnout and people's schedules. I think it would be probably something better to have like a presentation they can view online that kind of gives that information to people, and that way they can, if they have something they're passionate about or they really want to address, they have the tools there to go through the correct process, contact the right people, and not feel like they're being ignored or, that their issue isn't important to everyone.
Lisa, Kathy, anything?
You mean on what Jesse just
Yeah.
said? Yeah, I think that it's a good idea. I do think, we always say like refer to board policy, which is not fun. I'm going to tell you that. I know you think that nobody likes reading there's a lot of stuff in there. Sorry, policy committee chair, like maybe
you.
some people do. Like, there's a lot of stuff, listen. So I agree that to tell people like, here's the policy. And so it could be done in a very user-friendly format, like here's the process. And you can go and look at the policy that governs those decisions. So I think that's important to here's the policy that governs it, but you can talk in layman's terms as far as how the procedure works. I think, in the past we've done stuff with school finance very similarly. We can say, here's the book of school finance and read it, but we can also make it user-friendly so people understand how the tax levy works and all of that stuff. So I think it's doable and probably could be done. And people can just access it to make sure that what are your options for communicating and what happens and what's the, chain that you go through to make this happen or this happen.
Right.
Yeah.
So let me tell you a little story. So I was that guy, and Nancy probably remembers. I was all hyped up about I don't even recall what it was, and I wasn't on the board. And I came before the board, and I was ready to tell them what I thought. And they referred me to this little paragraph down below here. That it would have been this type of meeting, a workshop, that I couldn't speak. And I was fit to be tied. In my mind, I was calling these people all kinds of names. But it's right there for me to look and read. If I want to participate in the meeting, it's right there. It tells me.
Okay, I just threw that in there as one of the things. I think just as a general education piece of how it all
So
works.
where would we put that? We would put it on the website?
I mean, yeah, we could put it under our board page.
So they would read that as opposed to reading the agenda?
Hold on.
Well, I think you're more looking like a user guide or something as far as how the board operates and what we want to do. I agree with Quinn. That's right on all of our agendas all the time. But I think even though it's on there, having almost like a hey, I have a question. How do I contact? What is the function of the board or something like that? I get what you're saying. It sounds like you volunteered to do it. I get what you're saying.
So is anybody against having this conversation or trying to figure something out?
No, I would
go
hope that people aren't feeling ignored, because if they send emails, they always get answered. So,
I'm just saying the perception of that.
So is that like an information request, or is that like is it a discussion item?
No, I think like you said, it's almost like how our former director of business services, Mike, put together. Here, I'm going to do a presentation on how the school budget works, and he kind of did something. It's on our website where it describes the different funds and the different things, almost like a similar thing. How does the school board work? You're saying you do this, you say you could do that. You have a question like this. This is how you can get it addressed. And this is the direction you need to go. Almost like an easy guide to understanding our function.
So we can discuss it in the future. We can determine if that should go through policy committee or something like that first, and then come to the board and the whole board first. So we'll circle back.
And I know we talked about, how do we engage the community, and I think that was one of the pieces I was thinking of going towards that part of it.
Sure. Yeah, so we can have that conversation. So Kathy, do you have that?
So we're going to put in the policy that nobody reads?
Yes.
Is that what you said?
Creating more policies.
Got it. Perfect.
Okay. Anybody else? Okay, on to 7 announcements.
I got one. Coming up on Sunday, July 25th, Whitnall Youth Basketball Club is having a fundraiser at Sendik's, right off of Layton. And they will be selling, I believe it's hot dogs, burgers, those type of things, from 11 to 4.
Great.
Sunday, July 25th.
Any other announcements? Kevin, anything?
No.
Okay. All right, then we'll go on to 8. Take a motion to adjourn a closed session pursuant to Wisconsin Statute 19.851C to discuss superintendent evaluation.
So moved.
second.
Okay, roll call vote, Karen,
Aye.
Nancy,
Aye.
Jesse.
Aye.
Steven,
Yes.
Kevin,
Yes.
Wynn,
All right.
Jonathan, aye. Motion carries. Thank you. Thank you all for coming tonight.
Jonathan, somebody's got to take